bigger issue around tort reform, which is this idea that, which is a distinction between Haiti and I've experienced in Italy. I've got in-laws there, and I did my field work over there, so I've lived inside a foreign country too. But it's the way that Americans think about medicine through a consumer model, and it's the way our reform debate has been entirely thought through a consumer model. When you think about it, this notion that you get treatment for a certain amount of money, and then if it doesn't go well, you can sue for a certain amount of money back. I mean, this is about thinking through, health and wellness through something other than, family or community, or it's about getting into the marketplace, getting for yourself, and then this tort reform issue becomes an extension of the entire business model that flows out of it. So, I mean, my critique of the way that the current healthcare reform debate has unfolded is that there's been really no effort from the Democratic Party leading it to push something other than a consumer model, or even to have the type of critical discussion that you just engaged in very well about, look, there are other countries that have far fewer resources than we have, and they have something else in their minds besides, selling medicines for a certain price and establishing certain payments and so forth. They have nurturing their communities in mind, for example, just as a starting point. They have making sure everybody in the household is cared for, making sure when people age, they're not left alone. When someone has an operation, there's somebody there to take care of them. I mean, it's not easier in foreign countries to get health care. It's not free to get it, but they think through a different model. And my question after that entire long preamble is there any effort out there that you know of in this country to push people to a more productive, healthier worldview on what medicine is?
You might be able to answer that better. I mean,
just on the issue of tort reform, and I know doctors feel differently.
I'm not a doctor.
You're
even on the internet.
No, I was actually a physical therapist.
Oh, okay. Well, there's a lot of talk about tort reform, and I'm just speaking about the dollars and cents. People, it's the Republican solution, tax cuts and tort reform. Tax cuts are really not going to solve the healthcare catastrophe. Tort reform, although, we are a litigious society, and we shouldn't be, because there are no perfect medical outcomes. I mean,
so doesn't that...
But let me just say one thing about tort reform. Every study has shown that even if we had sweeping tort reform and, caps, and you couldn't sue doctors unless they took off the wrong arm, it would save something like 2%. It's a very, very small amount of money. Tort reform is not going to solve the healthcare crisis, and
nor is a public option, by the way.
Well, we disagree.
Absolutely, that's kind of the point of this.
Right. I agree with you. Only single payer will solve the problem. Only privately delivered, publicly paid for healthcare will solve the problem.
I don't know if that's going to solve the problem necessarily. I think that there's problems. There's problems that are endemic to every single situation. And you go to every different country that has various forms of health insurance, there are problems endemic to that. I think tort reform is a start, but I think that tort reform, the way that the litigious system that we're living in causes physicians to practice defensive medicine is problematic to begin with. It raises the price of the health insurance that's provided, or the health care that's provided for all the people, whether you have insurance or you do not have insurance. Another point that I'll make is that we're talking about 50 million people that are underinsured or uninsured. And that, of course, raises the insurance prices and the medical care costs for everyone who's involved, whether they have it or not. So, I think there are a lot of things that need to be addressed, and I don't think the public option is going to be the only thing that we need to do, and then the system's
Isn't that why the word option is there?
I'm sorry?
Isn't that why the word option is there? I mean, it's an option, it's not
mandatory.
A
single pay, yeah, sure, absolutely. I think that's a step in the right direction, but I think that, I've seen a lot of metaphors and analogies to the system, and putting like a Band-Aid on a dike that's ready to blow is not necessarily going to keep the dam from blowing. Right. We have a system that is fundamentally broken, and if we were to do it, and all of us in this room, we probably would all scrap the system and remake it. How do we go about doing that? How do we go about getting to a point where we can get, and we were talking earlier, how do we get to the point, the end point, where we're happy with the system that we have without fundamentally just absolutely decimating the system and reformulating? Because it's not going to happen.